Hi everyone, Candace here. Okay, so let's get serious. Today we're going to talk about melasma. What is melasma? Melasma is an overproduction of melanin, but the difference between hyperpigmentation, UV-induced sun damage, and melasma is bilateral, meaning both sides. Bi means two, lateral means side. So if you have hyperpigmentation, say in this cheek area or this side of the nose, it needs to mimic and it needs to be exact on, almost exact, excuse me, on the other side. So if you have it on the left, it needs to be on the right. You have it on the right, it needs to be on the left. Can't just be one-sided. That does not dictate melasma. Melasma is very structured. So you know what? Can I have a clipboard with a piece of paper and a pen? I think this will be a great visual. So generally there are three main areas of the face that melasma occurs: forehead, bilateral cheeks, bridge of the nose, and perioral or just upper lip. Perioral, peri meaning around, oral meaning mouth. So I'm going to show you my great artist work here. So melasma is also generally hormonal, and also melasma will either, especially, you know, it's mainly women that have melasma, but a lot of times what you'll see is either with or without birth control pills. Sometimes birth control pills will induce melasma. Pregnancy, post-pregnancy, breastfeeding. So a lot of times it ebbs and flows. It can stay quote unquote lighter and then become extremely dark. A lot of clients will say, oh yeah, I had it under control and it was lighter, and then I went on vacation and you know, this is what happened. So yes, the sun will definitely make it darker for sure. So don't you love my little picture? So melasma, and so this is the bat wings. Okay, so now that does not say that this whole area is going to be extremely dark. You know, I have seen it solid, and it's tough. I have definitely seen this solid, but I've also seen it where it wasn't solid. It was maybe darker in up towards the forehead, and then a little lighter here, and then maybe darker here. However, you can still see the bat wings. Then you have the mask, and you'll know exactly what this looks like. This is the raccoon mask. And again, sometimes you'll see it very, very dark in through here, and then it might get lighter in through here, and then it might get extremely dark here, and then again it will mimic, you know what I mean? It will definitely mimic. So what's on one side will be on the other. Now when it comes to perioral, this one's a little tough. This one can either be this, and you will definitely see the right and left pretty dark, and then a lot of times just under the nasal cavity will be a little bit lighter, or you're going to actually see this whole thing. So melasma, again, overproduction of melanin, the same right and left, bilateral or perioral or just upper lip. Hormonal changes is really the main cause of that. So treatment, we do multiple things here. First of all, you need to be on a proper at-home protocol, and two of the key items that we have in that protocol is going to be our B3 and pigment gel HQ free and pigment gel. So we're going to talk about hydroquinone. Hydroquinone, that's what the HQ stands for. So 1 month, you'll probably start on HQ free, depending upon your consult. Again, everything that we do here is individualized, so it depends. We'll either start you on HQ free or we'll start you on with. Now, this is the only product in PCA Skin that we will change on you. One bottle on, one bottle off, one bottle on, one bottle off. These are 4-month bottles. So when you finish your bottle of pigment gel with hydroquinone, you will not purchase another one. You will purchase a bottle of HQ free. When this bottle is gone, you will go back on HQ. And we do that because hydroquinone is a known carcinogenic, known cancer-causing agent. We're going to talk about that just very briefly, because the amount of hydroquinone that you have to have put into the body through your pores, through absorption, is immense for causing cancer. Now, back in the day, many years ago, when physicians used to prescribe straight hydroquinone, that is how they found this out. So PCA Skin, because they are very conscientious and very aware of the ramifications and the scientific data that has been brought about with hydroquinone, so they are the ones that dictate to us this type of protocol: on, off, okay? So that your body is not getting that amount of hydroquinone in it. So with that being said, we're going to go to treatment. There's other items that go along with a melasma at-home protocol, but I don't want to inundate you. Those are just two of them. So now we're coming to in the treatment room, treatment. So we have, again, we have hydroquinone free, with hydroquinone, and with hydroquinone and resveratrol. So these peels, PCA Skin, these are modified Jesners, and Jesner peels are mainly used for hyperpigmentation, including melasma. So a lot of times clients will come in here and they'll say, oh yeah, I've had a peel before. And we'll say, well, what did you have? You know, do you know what kind of peel you had? Oh no, I don't know, something that, you know, my esthetician put on me, or something at the dermatologist's office. Well, if you don't know what they're putting on your skin, you need to ask. You need to be very, very aware of what's going on you. We tell you what we're doing. We are going to tell you that what it is. We're going to tell you that it's a modified Jesner. We're going to tell you whether it has hydroquinone or not. And again, these are dictated by your bloodline. So for instance, someone like me that is pretty much pure white bloodline, I have a small amount of Italian in me. It's barely there. So this would be me. I would be top of the line, top of the heap, throw the kitchen sink at me, and I will be fine. I won't scar. When you get into Asian, your black heritages, all of those, your South American, people from islands, this is a no. And you would go into PCA HQ free. Again, everything is customized here, so we need to really talk to you and find out where you are in the Fitzpatrick scale, is what it's called, named after a doctor by the name of Dr. Fitzpatrick. And they are 1 through 6. However, here we only do 1 through 5. We've lumped 6 into 5 to err on the side of caution. middle of the road. We can also interchange these two. We can interchange these two with someone of my heritage. We can interchange these two with someone like a Fitz 2 or a Fitz 3. And again, you know, a lot of people don't really know what they are. It's just for us. So some people say American Indian, and then we'll look at them and we'll say, are you pure American Indian? And they'll say, no, I have da-da-da in me. When we come to find out, the American Indian is a very small portion of what they have, where really they're probably, you know, for argument's sake, you know, their majority is English and German. So, or somebody will say, oh, I'm Eastern European. Well, what does that mean? What are you, Eastern European? Well, you know, this and this, and then we'll look at them and we can kind of tell by their facial features, like high forehead is a giveaway, high cheekbones are giveaways. Eye color can be deceiving, so we really go by facial features. I'll say, I got a feeling there's something else there in you, and then they'll, well, yeah, you know, there's some Russian in me, or yeah, there's some German, and so that will give us other keys as to how we proceed with what treatment peel we're going to do on you. So these are great. Jesners are great for a variety of things, but mainly acne scarring, hyperpigmentation, melasma. And the beauty of these is that we can incorporate these with dermaplane. We can incorporate these with microneedling. Amazing, amazing treatment when we incorporate peels with any of those two treatments. So give us a call if you have any other questions. We're always here for you. Have a great day.